Yes, thank you. Have a good rest of your day too. Okay, bye now. And welcome. Nice to meet you. My name is Kate. What are you here in the clinic for today? A cranial nerve exam. Okay, that's fine. I can totally help you with that today. Have you ever had a cranial nerve exam before? Okay. And before we begin, do you have an appointment? Okay. Yeah, we do take walk-ins here since it's a student-run clinic. It's not exactly a regular hospital. University hospitals are always that way. So, what is your name? Okay. Date of birth? Do you take any current medication that I should be aware of? Okay, yeah. Yeah, we ask for medication because sometimes some of our tests can cause bad reactions for certain medications. Prior medical advice? Okay. Alright, so why are you here to get a cranial nerve exam today? Okay. I understand that, yes. So how long has this problem been going on for? You're asking why I write everything down. Well, this is student run, so our professors kind of like us to write everything down because they say it helps with memory. Yeah. So that's why our file systems are kind of more old-fashioned. Alright. And do you have had a cranial nerve exam done before? Great. That is helpful for me. Since I am a student, I am still learning. I'm not always 110% sure about everything I do. So I just wanted to warn you, but that's also why these clinics are cheaper. Yeah. Okay. Everything seems good. So, let's see. Alright, I've already washed my hands. Alright, so let me explain what a cranial nerve exam is, even though you've had it before. So basically, I will just be testing your different senses. So I'll be testing your sense of smell, sight, see how your eyes react to light, taste, I'll be doing that as well, hearing, basically all of your senses. Right, alright, sounds good. Oh, and also hearing. But we're talking back and forth right now, so we'll see if we have any problems with hearing in the future. Okay, sounds good. Okay, so first thing that we are going to test is smell. Okay, so this has a mystery smell in it. Do you have any? So sorry. Do you have any allergies before we begin? Okay, ready? Good. Okay. Next bottle. Yeah, they all kind of look like this. Because it's easier when they're clear. That way you have no hint of what it could be. Okay, close your eyes for me. Okay, good. And just take a breather and try to forget that last smell before we begin with the next one, okay? Okay, great. And ready? Good, okay, great. So, no problem with smell. Okay, so now let's do the skin chart. Okay, right. Okay, alright, so can you look at this letter for me? What does it say? Good, okay, let's go down to here. How about that one? Okay, good. And what about this red line? Okay. Green line? Okay, good. Alright. Have you had vision problems in the past? Okay, yeah. Do you wear glasses usually? Okay. Alright. Nope, you're doing great so far. Do not stress. I get a lot of medical anxiety. Don't worry, this is supposed to be a relaxing procedure. So truly, let's just take one deep breath. Ready? Breathe in. And out. Okay, you're doing a great job. Alright, so next, let's see. Now I need to see your visual field, so can you look at this pen for me? Okay, and tell me when it leaves your kind of perception, your field of view. Sorry, I always forget what that's called. I always want to say point of view and not field of view. Okay, so just look right at my nose and tell me when this leaves your field of view. Okay, good. Okay. 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 All right. Okay. All right. Okay. All right. Good. Great. And I'm so sorry for the background noise, but it is a clinic. So. Okay, so field of view is fine. Mainly a distance thing. Okay. Have you ever struggled with reading? Okay. Alright. Alright, so now I'm going to test your light reflexes. So please just stare right into my eyes for me. And I'm going to turn on a flashlight. It will be a little bright, okay? Okay. Okay. Just want to see if your pupil properly shrinks. You want to see how this works? Yeah, so I'm going to get in pretty close here. Hi. And if you look at my eye, the pupils retract when light goes in them. Yeah, so that's what I'm trying to see for you. Okay. Okay, good. Alright. So now, let me... Okay. Now I need to check your ocular movements. So, once again, look at this light and just follow it for me. Okay? Good. Doing a great job. Okay. Okay. Alright. Okay. Now tell me whether the light is close or far. Okay? So close your eyes for me. Okay, ready? Now open. Good. Close your eyes again. Now open. Good. Okay, close your eyes again. Open. Medium. Okay. Good job. Okay. Okay, so now I'll be testing your sensations with a light touch versus a pinprick. Okay? So let me show you what each feeling should feel like. That way you know what you're identifying. So I don't have a pin because I don't want to prick you with a pin. That does not seem very good. So I have this little like nail cutter, short hair cutter, I'm not entirely sure. We just had it in the back. And I'll be going like this. And it does feel sharp, but it does not hurt. Okay? And the opposing, more dull feeling will be my finger. Okay? So this is what my finger feels like. Okay? And this is what a pinprick feels like. Okay? Alright, so now I'll be doing that test. So please close your eyes for me. Thank you. Okay, ready? Good. 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 Mm-hmm. Mm-hmm. Okay, so now can you just put your arms out for me? I'm going to do the same test on your arm. Okay. Good. 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 Great. Okay. Now the other arm. Good. 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 Great. Alright, so that test is all done. You may open your eyes. Okay. And now let us do some tests for motor function. So, can you raise both of your arms for me? Good. Can you put your hands flat out like this? And I'm going to try and push your hands up and fight me on it. Don't let me push your hands up. Good. And can you try and give me a high five? Just good. And I'm going to drop my pen on the floor. Can you go and pick it up? Alright. Okay, so you struggled with the pen. Okay. Have you ever struggled with joint issues in the past? You have? Okay. Is that why you're on that medication? Okay. Is this a normal level of mobility for you on a daily basis? Okay. Alright, so just close your eyes for me and you see your facial symmetry. Okay. 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 Alright. So now your facial expressions. Okay, so can you smile for me? Oh, are you having trouble seeing? A little bit. You're better now? Okay. Can you smile for me? Great. Can you frown? Can you wink? Could you ever wink? Okay. Alright. Can you stick out your tongue for me? Good. Can you go like this? Okay. Great. Okay. So now I'm going to... do that one test. I already did another test that fulfilled that requirement. Okay, whisper into ear. Okay, so I'm going to have to whisper into your ear, and you're going to tell me which side I'm whispering into. Okay, ready? Hello. Good. Flower. Good. Okay. So, could you tell me what that last word was? Flower. Good. Okay. Great. Wonderful. Okay, can you cough for me? Can you cough on command? Okay. Okay. And I know this is kind of weird, but can you go like this with your tongue? Okay, up and down. Okay, good. Okay, great. Now let's do the final steps. Okay, so I need to do one more hearing test. And this one will be with this little gadget. And let me know when you hear the sound. Can you close your eyes for me? Great. Let me know when you hear a different sound that you're not used to. Okay. Okay, great. All right. And now I need to feel around your face just a little bit. Yeah, well, before I couldn't use the gloves for the test because sometimes our body won't detect the feeling of like real skin, but now that you've detected it effectively, I can just feel around. So just look at me. I'm going to feel around your face, okay? Can you feel that? Okay. How about that? Okay, good. Okay, great. Smile. Feel those cheeks. Oh, sorry about that. That was my glove. Okay. And let me grab these little guys. Can you tell me which slug is the most colorful? Okay. Now out of these two, which is the most colorful? Okay, good. Okay, great. And now, just gonna test your taste. Okay, so I'm going to put the flavor on a Q-tip. And just gonna put this gently on your tongue. Okay. Okay, now stick out your tongue for me. Okay, and what does that taste like? Good, vanilla. Wonderful. All right, so your vision is a little off and you have limited mobility, but you did already know about that. I will print out your results, that way you can give them to your primary physician. But the payment should be handled at the front desk. And don't worry, the rate is very much discounted since this is also educational for me. And hopefully my professor likes how I did this examination. Also, let him know he'll be right outside the door how I did. Hopefully I did okay. Okay, great. All right, well, have a good rest of your day, and I hope everything is well with you. Thank you. Happy holidays and a happy new year. Okay, bye.